Greetings from here, Abu Dhabi, United Arab Emirates. I'm Dr. Weaam Ibraheem, currently working in Salma Rehabilitation Hospital at Abu Dhabi. So I'm gonna share my screen. So thank you for giving me this opportunity to be here. It's my pleasure to share with you the recent article that I've done on last October 2021. It's a type of review article where it's about pathophysiology and clinical implications of cognitive dysfunction in fibromyalgia. So the type of study, it is a review article where I reviewed the last papers, articles, researches about the topic in the last 5 years and published on PubMed portal. So I choose this topic, actually, cognitive dysfunction, because I think the cognitive function or a cognitive health, it's one of the important part of our health. And when this got affected, definitely our achievement in our lives and our interactions with others will be affected, and that in turn affect our self-satisfaction and self-esteem. So in fibromyalgia patients, because actually most of the time there is ignored aspect of the disorder on those patients, that they have some cognition problems, and this got ignored by many healthcare professionals, and this can affect their lives so dramatically. So to have our introduction here, fibromyalgia, it's a disorder that commonly affects females than males, characterized by chronic generalized musculoskeletal pains and psychosomatic symptoms like fatigue, headaches, sleep disturbance, anxiety, mood changes, and cognitive dysfunction. And these cognitive symptoms can be more distressing than the pain itself and negatively affect their lives. And like what Dr. Scott Strassels, who is the research associate in Ohio University in America, United States of America, he said, what most people don't understand is that pain itself can cause harmful side effects and can affect concentrations and mental clarity just as profoundly as any drug. So that's what is fibromyalgia patients suffer from with their pain and thinking every day. And we try to review the recent articles, the recent researches, to see how these, how the healthcare professionals are aware of these cognitive problems in those patients, and what is the pathophysiology of these symptoms in fibromyalgia, and what is the risk factors, and what is the modality of diagnosis, treatment of these symptoms. So actually these cognitive symptoms or complaints are found to be truly tested symptoms. It's just not like an expressed complaints from these patients. And that what was found in a meta-analysis study in 2018, where 37 case control studies reviewed, and they found that the reported cognitive symptoms in fibromyalgia patients are associated with reduced performance of cognitive function in tests compared to control groups. So that indicate this cognitive dysfunction, it's truly objective tested symptoms and confirmed by the cognitive test. So we started with the pathophysiology of these cognitive complaints or cognitive dyscognition. We found that, or it has been proposed actually, that the fibromyalgia and its dyscognition are related to hippocampus dysfunction. And as we know, the hippocampus, it's part of a limbic system that has a great role in a memory, cognition, and learning process. And at the same time, this hippocampus has a role in nociception. Nociception, that means pain perception. So one of the proposed pathology or of this cognition that excessive consumption of neurotransmitter in the brain and responsible to excessive pain sensitization may lead to wasting neural resources needed for other brain functions such as cognition. So one of the proposed pathology that the symptomology of the fibromyalgia, that when they have excessive pain and excessive pain perception in their brain, there will be excessive consumption of their neurotransmitters that should be available for other brain functions. And another proposed or supposed pathology is that the development of fibromyalgia is triggered by stressful condition. And some studies had investigated how the stress hormone level, such as cortisol, is related to other symptoms of fibromyalgia. So in one study in 2018, where one study conducted by Lin, that assessed the level of cortisol and its relation to cognitive function in fibromyalgia patients, where a total of 44 fibromyalgia patients were compared to 48 healthy controls in terms of subjective cognitive complaints and objective cognitive function testing of memory, language, executive function, and the level of salivary cortisol were also checked. Samples were taken at awakening, 30 minutes later, 3 p.m. and bedtime. Results showed fibromyalgia group had more subjective cognitive complaints and poorer objective cognitive performance, and the cortisol level were lower in fibromyalgia group. So, however, in another study, which was done also earlier in the same year, in 2018, by Parcelo Martins, had shown that stress is related to memory impairment also in healthy controls like fibromyalgia patients. So another proposed theory that stress had had a role in fibromyalgia and its dyscognition as well. So in general, these are the pathologies that regarding the pain and regarding pain perception and stress. And I think that is very good to find it, because when we treat the pain properly and when we prevent or treat stress, anxiety, depression on these patients, we can help in improving the cognition for these patients. So then we come to see how is brain acting during the higher cognitive function tests in fibromyalgia. In the most of the previous researches, the brain function was assessed by using EEG, while patients performing specific cognitive tasks like verbal fluency test, multi-source interference task, go-no-go task. So we found that in one study in 2017 done by Gonzalez-Veller, there was an increase in neural noise in those patients. There were like 18 fibromyalgia patients. EEG was recorded while they are doing multi-source interference task. And the result of these EEG were converted to a power spectrum density. And the result indicates that there was neural noise, and that means there was less coordination between brain areas in response to different stimuli. Another thing also, we found that there was reduced frontal activity, and as we all know that frontal lobe is main area for higher mental function. So in 2018, a study done by Chu and his co-authors had also found a reduced frontal activity, which is the main area for higher mental functions during verbal fluency test using near-infrared spectroscopy. Near-infrared spectroscopy, it is like a non-invasive imaging for the brain to see the oxygenation of the brain tissue, and that means how the brain is functioning. So they found that the frontal area shown reduced activity. There are another 3 studies done in 2019, and all of them assessed they are like case control studies, and assessed the fibromyalgia patients, how they are performing in different in specific tasks, and how the brain is acting. And all these studies showed that the fibromyalgia patient has a problem in an inhibition task, and has a problem also are like errors in inhibition task and longer reaction time. So all the study, we found that suggested the fibromyalgia patient have difficulties in attentional processing and modulating their responses according to the task demand, as well as longer reaction time. And these studies explain how the brain is acting during complex interference tasks in fibromyalgia patients. These findings reflect a reduction in frontal brain activity and augment the hypothesis of consumption of neuronal and attentional resources to the pain, and reduce its availability and neutral facial expression to drive other cognitive responses to each task. Other thing we look at in our review is the risk factors of cognitive dysfunction. And it was really interesting to find that like tobacco smoking and high body mass index are related to dyscognition in fibromyalgia. And beside other risk factors such as pain duration and severity and depression. So I'm going to go to the study actually regarding the tobacco. So there was like a prospective questionnaire study was conducted by Lynn from May 2012 to November 2013, where a total of 66 fibromyalgia patients were surveyed and categorized according to their smoking status. And the cognitive performance, quality of sleep, quality of life, fibromyalgia symptoms, severity, anxiety, and depression were compared between the subgroups. Results showed that smoking has inverse effect on cognitive performance, worsening quality of life, increased sleep disturbance, and increased incidence of anxiety. And as every day by day it's confirmed that tobacco is affecting every aspect in our life. Another study assessed the body mass index effect on executive function in fibromyalgia, beside other variables like pain intensity, psychiatric comorbidity, and medications. Munoz Ladron de Guevara assessed the cognitive function using cognitive tests in 52 fibromyalgia syndrome patients and 32 healthy controls. They found that pain intensity and high body mass index have the largest proportion of reduced cognitive performance, where the mean body mass index in fibromyalgia patient was 28.9 plus or minus 4.4, while in controls was 26.4 plus or minus 4. But we need actually further study to confirm this. We couldn't find many studies regarding that. So in general, when we found that the risk factors that can help in managing fibromyalgia by preventing these risk factors, or by encouraging tobacco smoking, and cessation, and proper management of the body weight. Here are the studies, table of studies that we found about study design and the results. We tried also to see for any new modality of fibromyalgia dyscognition treatment. And fibromyalgia treatment divided to pharmacological and non-pharmacological. Non-pharmacological include physical function, encouraging the physical activity, and cognitive behavioral therapy, and so on. One of the new modalities, we found that using of non-invasive brain stimulation, like a transcranial brain stimulation, found to has a great role in improving the cognition in these patients, and other symptoms also fibromyalgia such as pain. We found like 3 studies done on 2017, and all of them assessed the using of transcranial brain stimulation, and found that this can improve where we put the electrodes on the brain and stimulating some part of the brain to improve the cognition and to improve the pain itself. So this actually, one of study also recommend to have this like affordable and to be like useful for these patients to use at their homes. So when we come to clinical implications of fibromyalgia and fibrofog, it's another name of dyscognition in fibromyalgia, diagnosis and treatment and prevention. So we found that early detection of cognitive function decline in fibromyalgia can be very helpful to patients for their daily lives and activities. There is a study done by Stevens Lopez found in a case control study that cognitive dysfunction in fibromyalgia patients can affect physical performance and increase pain catastrophizing. So it's wise to screen for any cognitive impairment symptoms and manage it properly to improve the overall health of fibromyalgia patients and to assure maximum physical functions. So it's like when we improve the cognitive functions, we improve also we will ensure the maximum physical function also for these patients. And cognitive complaints can be screened actually and can be traced during the clinical consultations by completing specific questionnaires, and can be also confirmed by using various measures or diagnostic tools. One of these, like using event-related potential and using EEG also. Like there are potential tools to detect cognitive dysfunction in chronic pain syndromes, including fibromyalgia. This is according to the recent study also in 2012. Another potential tool to assess the brain activity in the frontal area is to use near-infrared spectroscopy during verbal fluency test, as it was shown in the previous study. Neuroimaging, such as magnetic resonance spectroscopy, can be useful also for monitoring response to pharmacological treatment in fibromyalgia. There was a very interesting finding that we found fibromyalgia patients showed olfactory nerve dysfunction, and this found to be related to cognitive dysfunction. So Blanco and his co-authors conducted a case control study with 146 fibromyalgia patients and 122 healthy controls. They collected data using the Wechsler Adult Intelligence Scale, where to assess the cognitive function, and the Connecticut Chemosensory Clinical Research Center test to assess the olfactory functions. Results suggested that olfactory nerve dysfunction can be a predictor of cognitive decline and used as an early marker for dyscognition in fibromyalgia and other diseases also like Alzheimer's and Parkinson's disease. However, as we need more study to confirm these results. So while depression is frequently associated with a fibromyalgia, a clinical approach to detect and treat the depressive symptoms can play a great role in improvement of cognitive performance and management of body weight. Encouraging smoking cessation also can be useful. So our conclusion that the cognitive dysfunction in fibromyalgia might be caused by various mechanisms in the brain. It can be due to mechanisms related to disease symptomology, like excessive pain perception, where there will be a wasting of neuronal resources, and can be also due to mechanisms related to hormonal and metabolite changes in the brain that related to stress. It was useful to find risk factors of fibrofog to prevent the cognitive dysfunction in fibromyalgia. And this study has demonstrated the importance of screening cognitive complaints in fibromyalgia patients during consultations, and using various tools to assess and to confirm also the cognitive functions in fibromyalgia patients, and also using the recent affordable, effective, non-invasive brain stimulation therapy at home as a tool of management can be useful and more convenient to the patients. And this study also directs the researcher to conduct more studies about the risk factors, about the risk factors and diagnostic procedures for further development of clinical approach to managing fibromyalgia and fibrofog. Thank you very much for listening and stay focused.
Thank you so much. Thank you so much for